Understanding and diagnosis psychiatric disorder in children can be challenging and difficult in children as compared to adults. For example, in adult patient, they present if they present with depression, suicidal ideation, not wanting to live, wanting to die, most likely your diagnosis is major depressive disorder, and the treatment is with psychotherapy and SSRI, selective serotonin reuptake inhibitor medications. But in children, children and adolescent, young adults, they may present with depression, suicidal ideation, not wanting to live and wanting to die, but they may not have major depressive disorder. So how we can differentiate the actual diagnosis, how we can make sense of it? I think in children and adolescents, the most and the key important thing is not only what symptoms are happening, but why those symptoms are happening, why the child is presenting with depression and suicidal ideation. In my clinical practice, I am an assistant professor at Rutgers University and also have my private practice in New Jersey area. So many times children, teenagers, they present from school after writing a suicidal note that they want to die, they don't want to live. But when I'm trying to understand their story, and many times I'm learning that this child, have been struggling with learning disability, maybe reading, writing, mathematics. So now you can imagine an 11-year-old who wrote a suicide note, he, she, or they want to die. But since elementary school, they have been struggling with reading, writing, or any particular subject, and they are trying their best to do better at it. Their parents are working hard, having extra tutor, but no one is understanding, and everyone is getting frustrated to the point the child may become hopeless, may become helpless, and the only way to get out of that misery is to kill themselves. So they are writing a suicidal note. Yes, they were feeling depressed, but the reason they wrote a suicidal note is not because they are actually struggling with clinical depression, which we call, but actually their depression, their frustration was coming out of because of untreated learning disability. Let me share you another example. I was working at a big university hospital. Someone called me and for a suicide consult. 20 plus year old a young adult came after they jumped out of the third floor window and broken both of their legs. I'm using they, their, them pronoun just to maintain confidentiality. So the team, the medical team called me that this is a case of severe depression who need to admit this patient and start, some medication right away, some strong medication to help with the depression. So I went there, when I'm trying to get the history. Yes, the child, the young adult mentioned, yes, they have been struggling with depression, not wanting to live, feeling sad, feeling down. And they mentioned that, since very young age in elementary, middle school, they always struggle with paying attention, getting distracted very easily, problem focusing, very disorganized, room is messy, poor grades, despite they know that they were able to do it, but it was very hard for them to finish homework, returning their assignment, blurting out in class, problem sitting still. And when I'm trying to understand the context, what happened on that day, so they were mentioning, that they were at home and the mom was, so mom came to the room and found out that they were on their phone till 1 a.m. So mom got upset and told them that, she will take away their phone. And they got upset to the point that, they just told mom, if you didn't give back me the phone, I will jump out of the window and kill myself. And mom didn't give it, so they just jump out of the window. So what I learned was that, they were okay, they were, the night before, the day before, the week before, they were okay, they were happy. There were no obvious signs of depression, but on that day, they got so upset, they got so frustrated, and this impulse, that if I didn't get back the phone, I have to jump and I have to die. And out of that impulse, they jump. So when I understood the story, so it was all untreated ADHD and impulsivity, and out of impulse, they jump out of the window. So I did not diagnose them with a major depressive disorder because there was no time in their life where they were having signs of depression for every day for at least 2 weeks, and in those 2 weeks they were having other signs of clinical depression like feeling hopeless, helpless. Yes, there are history, they were feeling sad, mad, angry, and not wanting to live here and there. Only when things were getting frustrated, things were not going well,